Welcome to our podcast on feeding your baby. Today we are going to talk about techniques and tips that may help you breastfeed your baby. At the end, there is a list of places in your local area that you can contact for friendly help and advice. A common question new mums ask is when they should breastfeed. Ideally, try to start within 1 hour of giving birth before your baby gets too sleepy and where midwives and nurses can give you some hands-on help. After the first few days, your baby will generally need feeding every 2 to 3 hours, but this can vary. Try to feed your baby as often and for as long as they want. They will let you know when they're hungry by waking up and looking for a feed, making sucking movements with their mouth, and sucking their fingers. It's also important to breastfeed at night, as this is when you produce more hormones to help you build up your milk supply. Another important question is whether your little one is in exactly the right position. If you can manage to do the following, then your baby is in the right place and is attaching well to your breast. 1. Your baby's mouth is wide open. 2. You can see less of your nipple under your baby's chin than above. 3. Your baby's chin is touching your breast, their lower lip is rolled down, and their nose is free. And 4. It's not painful, although it can take a little while to get used to. And remember, tummy to mummy, nose to nipple, and baby to breast. Keep this in mind and you'll both get the hang of it. Mums are often also concerned about if their baby is feeding okay. If you can see and hear your baby swallowing, if they are sucking rhythmically, if their arms and hands are relaxed, if their mouth is moist, and if they have regular soak nappies, about 6 wet nappies a day, then your baby is feeding well. Here are a few extra tips to help out with breastfeeding, as it can be a bit tricky to begin with. Having early skin-to-skin contact can help breastfeeding and will also help you bond with your new little one. If the baby is not attaching well, try teasing their lips with your nipple to open their mouth. The milk at the end of the feed contains more calories than the milk at the start, so let the baby feed as long as they want. When your baby has come off the breast, it's good to offer the other breast, but they may be full. If you want someone else to feed your baby, then an easy way of doing it is by expressing your breast milk. This can be done by hand or with a mechanical pump. You can then feed the baby with it from a cup or bottle, or alternatively store the milk for later use. Make sure you use the breast milk within 24 hours unless you freeze it. Frozen milk can be kept for 1 week, or up to 3 months if it is in a deep freezer. But once it has thawed, use it within 24 hours and don't refreeze it. Mums often ask about how long to breastfeed a baby for, in order to provide the best for both mum and baby. Giving your baby only breast milk for 6 months is ideal, as the milk has absolutely everything your baby needs up till then. At about 6 months, your baby may be ready to try some solid food. They are ready for solid food if they stay in a sitting position and can hold their head steady, can look at food, grab it, and put it in their mouths all by themselves. Swallow their food. If they end up with more food on their face than in their mouth, then they're probably trying to tell you that they're not ready. If your baby starts waking in the night but isn't ready for solid food, just give them more breast milk. Your body will keep up and make more for them. Remember, if breastfeeding feels like a lot to start with, after about 6 weeks, most babies feed less often and take less time to feed, so it will get easier. So you've listened and looked at the tips and techniques for breastfeeding your baby, and we hope that they've helped. But we know that the path to being a perfect mum is tricky and sometimes pretty tough. And if it doesn't work out for you, please don't feel like a failure. Here are a few places that can give you some more help. You can contact your midwife or health visitor or get in touch with your GP surgery. You may also want to try Godmanchester Children's Centre, which is available for all Huntingdon and Godmanchester mums, and the groups will be a chance to swap stories with other mums and get advice from ladies going through similar things to you. Thanks for listening, and check out our other podcasts on the pros and cons of breastfeeding and answers to common concerns that many women ask when breastfeeding.